This is 14th November, and 14th November is World Diabetes Day. So the day 14th November was chosen to commemorate the birth anniversary of Sir Frederick Banting, who co-discovered insulin along with Sir Charles Best. And the theme of this year's World Diabetes Day is Education to Protect Tomorrow. So this year, on the occasion of 100 years of discovery of insulin, let us get educated about the correlation between insulin and diabetes in this video. So every single cell in our body has some work to do, and for doing this work they need energy. This energy is generated from glucose molecules, and these glucose molecules we get from our food sources. So whatever the food we consume is ultimately converted into glucose, or it is broken down into glucose, and this glucose is utilized for generating energy, and this energy is utilized for performing the works, for performing the functions of the cells. But there is a glitch. For generating the energy from glucose molecules, every single cell has to absorb glucose molecules, and this is not possible without the permission of insulin. In this way, the insulin acts as a gatekeeper for entry of the glucose molecules into the cells. Cells cannot absorb the glucose molecules without the permission of insulin, and eventually they don't get energy for performing their work, and this leads to fatigue in diabetic patients. And as a second part of this story, the glucose which is not being absorbed remain in the blood for longer time, and this shows the spikes in the sugar level, which we call as high sugar levels, and that leads to diabetes. So this determines the role of insulin in diabetes. In any non-diabetic individual, after consumption of food, the glucose enter into the blood circulation, and insulin is secreted by the beta cells of pancreas. This insulin allows the entry of glucose into the cells, and cells generate energy from these glucose molecules, and this mechanism maintains the glucose concentration in the blood. So there are a few basic types of diabetes. In type 2 diabetes, the beta cells of pancreas secrete insulin, but our cells are resistant to insulin, and the insulin cannot work effectively, efficiently, so the glucose cannot get absorbed by the cells, and it remains in the blood, showing blood sugar level spikes, and this is called as type 2 diabetes. Whereas in type 1 diabetes, there is absolute deficiency of insulin, and it is because of complete destruction of beta cells of pancreas. So there are no beta cells, and the insulin is not secreted, and that leads to spike in the glucose levels. This is also called as insulin dependent diabetes, because the person with type 1 diabetes cannot survive without insulin doses. The third type of diabetes is gestational diabetes, which occurs during the third trimester of pregnancy, and this diabetes is because of the insulin resistance generated because of the pregnancy hormones. The pregnancy hormones create insulin resistance, and that leads to rise in the sugar levels, and that is called as gestational diabetes. Gestational diabetes generally go away after delivery, but if the proper lifestyle is not maintained, it can reappear within 10 years after delivery. And then there is a new kind of diabetes, or in recent days we can see steroid induced diabetes, which occurs because of steroid injections or any kind of steroid medications, as we saw in the COVID times. So these steroid infusions can cause insulin resistance, and that leads to rise in the sugar levels, which leads to diabetes, which is also called as steroid induced diabetes, and this is a reversible kind of diabetes. Like gestational diabetes, it is a temporary phase when the steroid hormones or steroid medications are stopped. These diabetes reverse to the normal condition.